record in case number C-356489, Stephen Matter versus Anthony Holloway. The record reflect the presence of parties, counsel, and all of our jurors. Welcome, everybody. Good morning. Be seated. Everybody can be seated. And the state, please call your next witness.
The state calls Cody Eubanks.
Sir, if you raise your right hand, the clerk will swear you in.
You do solemnly swear that the testimony you are about to provide in this action shall be the truth, the whole truth, and nothing but the truth. So help you God. Thank you.
Sir, go ahead and have a seat if you would. Good morning. If you could, please state your name and spell it for the record.
Cody Eubanks, C-O-D-Y, Eubanks, E-U-B-A-N-K-S.
Whenever you're ready.
Thank you. Sir, as of May 13th of 2021, how were you employed?
With Protective Force International.
And what was your role or your job?
Corporal,
Okay, and what type of job was that?
armed security.
Okay. And what were your responsibilities and duties as a corporal or armed security?
Covering down shifts, mobile patrols, and that's about it.
Okay. Did you work a shift on May 13th of 2021?
Yes.
Were you assigned to work that shift at 370 East Harmon Avenue?
Yes, sir.
And is that here in Clark County?
Yes.
And what time were you working that shift?
My shift that day was a 12 to 12, 7 to 7.
Okay. So 7 a.m. to 7 p.m.?
Yes, sir.
Okay. Now, during that shift, did you come into contact with any individuals in your capacity as armed security? Did you come into contact with anybody?
Yes.
What was the nature of that contact? Who did you come into contact with?
2 males stating they were looking for a friend that was on property.
Okay. Were you able to help them find their friend?
Yes, sir.
Was that friend's name Jacqueline?
I believe so, yes.
Did you make contact with that friend?
Yes.
And when you made contact with her, were you able to observe her mood or her disposition?
Yes.
What was it?
Scared and skittish.
Okay. What do you mean by skittish?
Didn't want to be around anybody, didn't want anybody to touch her.
Okay. Were you able to observe anything of note physically about her?
She was crying, scratches and bruises on her body.
Okay. Did she explain why she was distraught or skittish?
Yes, sir.
Objection,
Your Honor, it's
The objection's overruled to that question.
thank you. Did she explain why she was distraught or skittish?
Yes.
Why?
She said that she had been sexually assaulted.
So, all right.
And Your Honor, it's an excited utterance. She's skittish. She's.
Objection's overruled on that basis.
Okay. So, what was her explanation for being
That she
skittish?
had been sexually assaulted.
Did she explain further?
Yes.
Do you remember that explanation?
That she was with an individual. He assaulted her and then dumped her down the street, and she wandered to that property.
Okay. Do you remember what clothing she was wearing?
A black top and shorts.
Okay. And were the police called?
Yes, sir.
Who called them?
I did.
Court's brief indulgence, please. Now, when you talked to her, do you remember if she said where an assault happened?
I don't recall.
Okay. Now, you conducted or had contact with police after you reported this incident, is that correct?
Yes, sir.
And did you make a statement to them?
I did, sir.
And was your memory of the event at that time more fresh in your mind than it is today?
Yes, sir.
Would reviewing your statement to police refresh your recollection as to what you said or what you heard?
Yes.
Okay, I'm showing defense counsel, page 4 of the voluntary exhibit. We're looking, what she told him. May I approach the
You
witness?
may.
Thank you. So I'm going to have you read to yourself just this paragraph right here next to the A. And once you've read it, if you could look up at me, please. Now, did reading your statement to police refresh your recollection as to what was said?
Yes, sir.
And what did she tell you about the
That she
events?
was with an individual named Anthony. They were supposed to go get food and hang out. They didn't. And then they went straight to his house and they got violent.
Okay. And did she tell you that he told her, I brought you here for one reason and you know what that was for?
Yes, sir.
Did she tell you that he made advances on her?
Yes.
Nothing further for this witness.
What time was it when you first came in contact with the two males?
I don't recall.
No further questions.
Mr. Judd, anything else?
Briefly, Your Honor. Do you remember telling police that you made contact with the two individuals before 7?
Yes. Before 7 a.m.
Nothing further.
All right. Anything else, Mr. Charles?
No.
Anything from the jury? No? All right, thank you, sir. You're free to go. Please call your next witness.
Jeri Dermanelian.
Just take that in there.
You do solemnly swear that the testimony you are about to provide in this action shall be the truth, the whole truth, and nothing but the truth. So help you God.
Yes.
Thank you very much.
Good morning, ma'am. Go ahead and have a seat. And if you could please state your name and spell it for the record.
Jeri, Jeri, Dermanelian, Dermanelian.
Just have to show whenever you're ready.
Thank you, Your Honor. Hi, Ms. Dermanelian. Thank you for joining us today. Can I ask where you work?
I own a company called Rose Heart.
And what do you do at Rose Heart?
I'm a sexual assault nurse examiner. I do forensic nursing.
And is Rose Heart associated with any hospitals in the area?
Yes, I work out of University Medical Center, Adult Emergency Department.
And you mentioned that you own Rose Heart. How long have you owned that company?
2009, October, the end or beginning of November 2009.
You know, you mentioned that sexual assault nurse exams. What does a sexual assault nurse do?
We provide examinations with various options to people that come in that state that they've been sexually assaulted or raped.
And can you describe the training and experience you have that allows you to do that?
Yes, I'm a registered nurse in the state of Nevada. I maintain my licensure as a registered nurse. I have a bachelor's in nursing from University of Nevada, Las Vegas. Associate started in Lake Superior State in Sault Ste. Marie, Michigan. I've been a nurse since 1981, worked primarily in, started out in Ely, Nevada, worked for a while there, 4.5 years, and then I came to Las Vegas and worked out at University Medical Center in the emergency department, as primarily in the emergency department. Ultimately, I started a company where I taught a lot about domestic violence. I would teach basic life support, pediatric life support, trauma nurse core courses. Put together an educational program for the hospital, a 16-week course to teach nurses how to be ER nurses. While I was doing that, I would teach the domestic violence portion for the original owners of Rose Heart. They've been in business for 25 years, and so I would do their domestic violence training for them when they would teach their 40-hour course on how to become a sexual assault nurse examiner. After I retired in September 1st of 2009, the owners of Rose Heart approached me and asked me if I would be interested in becoming a forensic nurse. And I was too young to retire, so I was always interested in helping people. So I took the 40-hour course from them, and then I did the 300 hours of hands-on training with with Linda Ebert and Miriam Adams. I also did training with the medical director that was my medical director for a while, Dr. Dale Carrison. I was trained, and then I took a International Association of Forensic Nursing course. I also took their certification test and became certified as a sexual assault nurse examiner for adolescents and adults. And then after a while, I went back and became a sexual assault nurse examiner certified for pediatrics. So I'm mandated to continue my education every 3 years, not only for my state licensure, but also for the certifications through the International Association of Forensic Nursing, which I am a lifetime member of. I'm also a lifetime member of the Emergency Nurses Association. I have taught the 40-hour course on how to become a sexual assault nurse examiner. I have trained multiple nurses and had them do their 300 hours of didactic with me, hands-on with me. I currently have the residents spending 1 day a week with me at University Medical Center so they can learn. And I also have 2 current nurses that are training under me to become sexual assault nurse examiners. I have at times had the ability to provide continuing education units through the State Board of Nursing. So I put on continuing education unit classes regarding sexual assault. I'm frequently asked to speak at the Air Force Base. I'm speaking at many of the Las Vegas Metropolitan Police substations. University Medical Center asked me to teach when it's time to teach for them. Anyone that asks, I go and teach for them. So I go out into the community for the Signs of Hope, which used to be called the Rape Crisis Center, and do trainings with them, as well as other community members.
And you mentioned that you are certified to do sexual assault exams for adolescents and adults and children. How long have you been certified to do sexual assault exams for adolescents and adults?
Since 2009. Every 3 years I'm mandated to renew, and I do 45 hours of continuing education units. I've also added into my certifications interpersonal violence certification, which is the most recent certification that I have offered through International Association of Forensic Nursing. Also, I have stepped out and started a forensic strangulation program that is currently being utilized at the county for the last 7 years, where we offer strangulation evaluations, which is part of a S.A.N.E nurse's process. And we do those exams also, as well as suspect exams.
And how many exams, if you could even ballpark, would you say you've done since 2009?
I'm going to estimate approximately 14,000.
Now, you mentioned that you have some nurses that you have trained and are working for you. Is one of the people that you hired at one point a nurse by the name of Rosemary Deno?
Yes.
All right. And
It's Menno.
oh, I'm sorry.
Yeah.
Menno. And do you recall when you hired her?
It was approximately 11 years ago. She approached me and was interested in doing forensic nursing. She'd done some forensic nursing or forensic work in Hawaii as a technician. And once she became a registered nurse and came to UMC, she approached me. So I told her what she needed to do, which was to go through the 40-hour course that the International Association of Forensic Nursing offers, which she did. Once she completed that, she presented her certificate, and then we did the 300 hours of live training.
Okay. Now, was Nurse Menno working for you in May of 2021?
Yes.
And when she began working for you, obviously you talked about the certifications that she has, and you would know that as her employer, fair to say. Did you supervise her when she first started?
Absolutely.
Did you work closely with her?
Absolutely.
And in fact, were you working side by side with her?
Absolutely.
Is it your experience that she followed her habits and customs when performing exams?
Yes.
And have you testified here in the 8th Judicial District Court before?
Yes.
So I would like to talk to you a little bit about the procedures for exams. Can you talk to us about what a sexual assault exam is?
Well, people have options when they come in. If it's all right, I will go through the options with them.
Sure.
Option one is that they can decline the exam. Patients need to know they're in control of what's going to happen to their body, so they can choose after they hear about all the choices as to which option they want to go with. No one would ever force a patient to have a sexual assault exam. Everything is done voluntarily at their request. Option two is they can have a medical exam with no forensic evidence collected. Medical is designed to protect them from sexually transmitted infections, injuries, or treatment for prevention of pregnancy. The third option is generally called a Jane or a John Doe or an anonymous option, where a sexual assault kit is collected, which is very invasive and very intrusive to have occur. Medical is administered, but the patient declines to have law enforcement involved, so their kit is stored by myself at University Medical Center for up to 20 years until they decide what they want to do with their case. Option four is, I call it the full Monty. That's where they're requesting law enforcement to come in and start their process. I would, or Rosemary or the nurse would gather the sexual assault kit, which is again invasive and intrusive, and medical would be administered for them. They'd be given referrals to the Signs of Hope, and treatment would occur.
Now, is it also possible that a patient could come in, decline the exam, and then still make a law enforcement report?
Absolutely.
So it would be possible to report someone to police without going through the invasive sexual assault exam?
Yes, they always have the right to make a police report at any time they want.
Okay. You talked about the assault exam being invasive. Could you describe for us what you mean by that?
To do a sexual assault exam from a forensic standpoint where a kit is going to be collected, you need to collect a basic medical history because the thought process is that you may have medical conditions that can compete with injury patterns or signs and symptoms that would compete with our decision when we make decisions on whether something is consistent with a sexual assault or not. So a detailed medical history is obtained. Narrative of the event or the history of what happened is taken. Many questions are asked after the patient does their initial what happened. And then there's the sexual assault kit collection. To collect the kit, you tell the patients that you're going to do a head-to-toe assessment where you look, listen, and feel in every orifice of their body. You're going to take DNA samples from the back of their throat, the cheeks of their mouth, underneath their nails. You're going to do, on females, a speculum exam. A speculum is a plastic tool that's placed in the vagina that allows us to open the vagina walls up and look at the end of the vaginal wall for the cervix. We take swabs from the vaginal wall. We take swabs from the cervix. The anus, they're put into what's called a knee chest position after the speculum exam. and that's where their knees are on the table and their head is down on the paper, and their butt cheeks are spread in a manner that allows us to look at their perineum and the anus, and we take swabs from the anus. And then there's an anal scope, a small cylinder that's about 4 inches long that's placed into the rectum, and swabs are taken from the rectum. Photographs of their entire body, head to toe photos, genital photos, vaginal wall, cervical os, anal and rectal photos are taken. If they have any other injuries, such as cuts, lumps, bumps, bruises, contusions, abrasions, erythema, swelling, photographs of those injuries will be taken also. They have blood drawn. They're tested generally for HIV, hepatitis B, hepatitis C, and syphilis. While the speculum exam is being done after the DNA evidence is collected, a gonorrhea and chlamydia culture is taken from the cervix and sent to the lab. After that is completed, generally there's a urine obtained. Sometimes the urine can be obtained before the exam, and that's sent down either for a pregnancy test and or urine drug screen. Sometimes if there's alcohol involved, there will be a blood alcohol drawn as well as the other STI tests. There's going to be prophylactic treatment for gonorrhea and chlamydia, which are the two most common types of sexually transmitted infections we see. That includes generally a shot in the butt cheek, and then you're offered a morning after pill or the emergency contraceptive medicine. Some people call it Plan B. We call it levonorgestrel, which would inhibit a sperm and an egg from uniting. They're given a referral to the Signs of Hope. They talk to the advocates, and then they're given discharge information reminding them in 12 weeks they need a second HIV and a second syphilis test. Now, if they have any other injuries that require any other treatment, that treatment will be started, initiated. If they need the emergency physicians or medical treatment, the residents and the doctors will come in and assist us.
Now, you talked about the head-to-toe exam, the vaginal exam, the cervical exam, the anal exam. How long does this entire procedure take?
Approximately 4-hour period of time, and that includes the time that the person that's doing the exam has to coordinate any tests, any labs, coordinate with law enforcement, and that includes dictation and sealing the kit and making sure that the evidence is collected properly with clothing. There's a lot to these exams. They're not simple.
Now, you talked about collecting evidence and sealing the kit. Can you describe, you talked about how that happens before the vaginal exam, but can you describe exactly what that procedure entails?
So the kit itself is one very large envelope that has fibers in it that allow it to expand. And inside that very large envelope, which it's demonstratively approximately the size of this, what I'm showing you here.
And just, sorry, I'm going to stop you. For the record, you're holding up a like 8.5 by 11 manila folder.
Yes, ma'am.
Thank you.
That is sealed, and on the outside of that kit, there is a sexual assault kit number. It always starts with the letters R, S, and then on the front of that, there would be a place for the agency that's going to be receiving or requesting the kit, like Las Vegas Metropolitan Police or Henderson Police or North Las Vegas. Then underneath that would be the event number or the event number from the police that's generated. And then the patient's name is written down on that. Outside, the date that they're seen is written next. Where the exam is done, so UMC or University Medical Center would be placed there. And then there's a place for a signature for the nurse or the person that gathers the sexual assault kit and signs for it. And then below that, there's a line that divides, and then evidence, people that touch the kit afterwards, every person that touches it to maintain chain of custody has to sign that area. Once that seal on the back of the kit is opened, you use gloves, you pull all of the envelopes out. There are many envelopes that are individually sized for the different areas that we swab. For example, there'd be one envelope that's approximately 6 by 8 inches long that has the word oral, O. In that envelope itself would be a 6-inch long, approximately 1/4 to 1/2 inch wide box. And you have to take a label that's inside the kit, the RS number, the kit number, and apply that to that envelope. And then apply one to the box. And then we use hospital generates a set of labels that has the patient's name, medical record number, another tracking number the hospital uses, their date of birth, their sex. It's going to be, and their age shows on that label. That label, since it has their name, we always ask them, would you look at your armband and make sure your name is spelled correct and your birth date's correct? And then those labels are used to put on each individual box. So there's an envelope for O for oral swabs. There's an envelope for B for buccal swabs. That's the inside of your cheek of your mouth. There's a envelope with two small boxes for fingernails. So the right hand would be swabbed, the left hand would be swabbed. Paying particular attention underneath the nails with the swabbing. So each box right hand would have a box, left hand would have a box with the kit number and then the patient's identification on there. There'd be an envelope with vaginal and cervical small boxes in there, so that when you take the vaginal wall swabs, you put that in that vaginal box, and then cervix you're going to put in for the cervix swabs that you take. The next envelope would be anal and rectal. So when you do the anal exam, you have two small boxes, and you're going to put the swabs for the anus in one, the swabs for the rectum in the second. Then you have bite secretion envelope, you have miscellaneous envelopes for other areas that may be swabbed. Sometimes you swab breasts, sometimes you swab neck, sometimes you swab maybe fluid noted with our crime light, maybe on the leg or the buttocks or something of that nature. If there's like underwear, the underwear is going to be collected. Generally, we photograph the underwear, and then it's placed in its own envelope. The underwear envelope is bigger than the general envelopes I just described to you because the size of underwear, well, not always, but the size of underwear can vary, and so that envelope has to be a little bigger. So that is going to be separated out, even if the patient comes in with their clothes on, and we have to collect their clothes. The clothes are separated out into individual paper bags, labeled, and then ultimately given to the detectives. But the underwear specifically generally goes in the kit in a specific envelope called underwear. And that has the RS label or the kit label on it. And then we seal it. Once everything is done, there's a paperwork or an electronic record that we have called SART-SMART. And then the kit actually has paperwork. If our electronics is down, we revert back to the paperwork that's check-off list in the kit. SART-SMART is an electronic form of sexual assault kit history collecting and checks the box as to what do we do. And that is put into its own envelope, and then that is sealed. Once you gather all of your evidence, you're going to place each envelope into the bigger envelope, and then you're going to seal it with an evidence seal. And you seal that with, once it's sealed, you put your initials on the seal and the date that you signed, sealed it. And then once that kit is filled out correctly, because on the back of the sexual assault kit, they have currently right now, and in this case, a checklist to say to let the scientists at the crime lab know what's inside this kit. Is there underwear? Is there a buccal swab? Is there a vaginal? Is there a cervix? So they know kind of what's in the kit without opening it. Once that is done, that kit then is locked up. We have a locked area inside the S.A.N.E room where the actual exams occur. And then once a week, the crime lab from Las Vegas Metropolitan Police meets me, generally. Occasionally Tina or Rosemary. They'll meet me outside at about 8:30 in the morning, 9 o'clock on a Monday, and we have a list and exchange the numbers of kits that they pick up, a log we produce, and then they verify the log. And then they leave and take the kit to the Las Vegas Crime Lab, and then it's their property from that point.
Okay, so, and I just want to back up for 1 second. and ask you a question about the exam itself. Now, what you described was invasive. Do you explain to patients how invasive the exam is going to be before they check off on which option they want?
Absolutely, they need to know what's coming at them so that they're not caught by surprise. And probably you would assume, and you would be correct, that generally the pelvic exam and the anal exam is what patients have the most worry about. They want to know, is it going to hurt? They're going to want to know, do they have to do the rectal? If there was no penetration, they'll say to the rectum, do I have to do the rectal? And then we have to educate them as to why we have to do the full kit.
Now, if a patient starts the exam and, maybe intellectually they realize how invasive it's going to be, but then they start the exam and it feels worse than they thought it would, can they stop the exam at any point?
Any point in time, and we have done that. I have done that.
And in terms of, now, in terms of the matter that brings us to court today, was there a kit that was done, completed and impounded under Metro Event Number 210500058113?
Yes,
And was that for patient Jacqueline Rodriguez?
yes,
And did she present as a 21-year-old female who was approximately 5'3" and 130 pounds?
yes,
Now, did I ask you to review the documentation that had been generated in association with that exam?
yes,
And did you do that?
yes,
Did you, I think you had mentioned that photos were taken of the vaginal area and the body. Did you review those as well?
yes,
And the kit that was done, was that a sexual assault exam that was completed, in this case, by Rosemary Meno on Jacqueline Rodriguez?
correct,
And that was done on May 13th of 2021?
correct.
In reviewing the documentation, were there any visible injuries that were documented?
Yes.
And what were those?
She had extensive abrasions on her anterior thorax. When I say extensive, when I looked at the photos, I was like, what is this? There were abrasions over her entire, from where your sternum is down to past where the breasts are. And they were everywhere from the up, down, right, left side of the axillary region. She had abrasion on her elbow. She had abrasion on her hand. She had abrasions on her leg. That's what I saw. She had some abrasions on her back.
Did you observe any injuries to the vaginal area?
I did not.
And does that mean that there was no sexual assault?
Absolutely not. What you need to be educated to is the vast majority of sexual assault victims do not have any type of injury to the vagina and or the rectum during a sexual assault. It is the exception to the rule to have a bruise, laceration, a tear, redness, or swelling to the vagina, the cervix, the perineum, anus, or rectum.
With regard to the vagina in particular, why is that?
Well, if you think, what is the job of the vagina? The job of the vagina is to expand and contract, and that's its job. It will produce mucus. Whether the person wants mucus to be produced or not, it will produce, and that's a lubricant. And so the job of the vagina is to expand and contract, whether it's a finger, a penis, a tampon, or any other objects. And with that expansion and the lubrication that can occur, there's generally no injuries seen.
Now, in reviewing the documentation, did that indicate that Jacqueline Rodriguez had gotten to the hospital at approximately 8:41 the morning of the 13th?
That's correct.
And was she there until, for a few hours?
She was,
Was it until the afternoon?
yes.
And was that because she was going through the full body exam?
Yes, yes. Rosemary saw her, she came in at approximately 8:30-ish, and Rosemary saw her approximately 11:30 or 12 o'clock in the afternoon, if I remember reviewing her chart.
Okay. Do you recall what time she was discharged?
At about almost 3 o'clock.
Okay. Past witness.
Good morning.
Good morning, sir.
You did not personally do any examination on this Jackie, did you?
That's correct.
Okay. So everything you know about her case or her file comes from the nurse that actually prepared the report you reviewed?
That's correct.
You had no conversations with the alleged victim?
No, sir.
You reviewed photographs that were given to you by the registered nurse, Nurse Minnow?
Yeah, it's in the process we call secure digital forensics imaging. I'm the only one that actually has access to it, so I look at all photos.
Okay, so
Yeah.
does the nurse take the photo and then it loads up into a system that you review?
Yes,
Okay.
she actually has access to look at her photos, but I lock and have the only control over who gets in and gets out of that process.
As the owner and the director,
Correct.
that's confidential information, you make
Correct.
sure that
It's on
you're the
its
one who
own
gets it.
server, trying to protect
Right.
privacy.
Right, I understand. Now, you talked earlier about some abrasions and contusions on her body. These were the chest, the elbow, the hand,
Abdomen,
abdomen,
thighs.
and some on the back, correct?
Yes.
Okay. But none in, just to be clear, none in the vaginal area or the pubic area?
No, sir.
Okay. And you said that often there won't be signs of trauma for a sexual assault victim in the vaginal area or the rectal area, right?
That's correct.
Okay. What is the purpose of doing the examination in those areas?
To identify what their anatomy looks like, to identify do they have a cervix, to gather the DNA evidence from the vaginal walls and the cervix. We use toluidine blue dye to assess whether there's injuries, calling mounting injuries to specific areas called posterior fourchette and fossa navicularis. We swab the vaginal and cervical area, later look on a slide for sperm to try and determine whether there's sperm present in the vagina.
In this case, do you recall if there was sperm present in the vagina?
There was no sperm.
Okay. Do you recall the DNA from inside the vagina?
There was DNA samples taken from the vaginal walls and the cervix.
Do you remember the results of those?
I don't get the results.
So you don't know anything about the DNA, and that's just part of the process of collecting?
Correct.
So your nurse would collect the swabs?
Correct.
Those would go to, I'm assuming, a forensic scientist lab for, is that separate from your office?
Oh, yes.
It's a separate department?
That's the Las Vegas Crime Lab scientist.
Okay. And you follow all the proper chain of custody and make sure it's sealed and it's provided?
Yes, sir.
You work with law enforcement a lot, so you know their procedures, correct?
Yes, sir.
Okay. But that wouldn't be anything you would have any personal knowledge about the collection or sending it in this case?
Other than I would have been the one to hand it off to the courier.
Okay. So I'm guessing you're familiar with the reports that your office produces.
Yes, sir.
So I'm looking at looks like the final nurse notes. And all I want to ask you is, In terms of examination, of medical examination, I've seen a lot of paperwork that talks about where there might be bruises or contusions or cuts. But in the nurse notes, the final that's usually the final portion of your reports?
I'm not sure if you're pointing to SART-SMART or if you're talking about her dictation.
Do you mind if yeah, it's just. May I approach that? Just taking a look here.
Okay,
Never
that's
mind my
the
little scribbles. Do you recognize this?
Yeah, that's the SART-SMART.
Okay, so in that SART-SMART report, that's where the nurse notes are input at the conclusion of the examination, is that?
That would be
correct?
after the patient had, yes.
And is that what it looks like in
Yep.
this particular report?
Yes, sir.
Okay. Now, in this report, there's only the pelvic exam and the rectal exam that are reported, correct?
In the SART-SMART, the
Right.
rest of the exam is reported in her dictation for the hospital.
Right. So, but this report where it's actually, this is the report where it's the final nurse's notes regarding the sexual assault portion of the examination, correct?
I would say no.
Okay.
It's a combination of the dictation, because
Mhm.
that's got the medical history, and it shows the head to toe.
Okay.
And then she chose to put just the pelvic information, rectal information in the SART-SMART.
Okay, so
not
there
double
could,
documented.
that's kind of a nurse's call. She could have put other things in these notes if she chose
Absolutely.
to. Okay.
Her notes.
But in terms of the physical exams, in this particular report, do you recall that she did just put the pelvic exam and the rectal exam?
That's correct.
Okay. And what would be the significance if a victim of sexual assault in this exam, what would be the significance if there were hematomas, lacerations, crythema, swelling, abrasions, contusions, or divots noted to the fossa navicularis or posterior fourchette? What would be the significance of those findings, if they existed?
Yeah, the posterior fourchette fossa navicularis is the most common area where we see injuries. If there is going to be an injury seen, generally that's where we'd see it most often. It's called a mounting injury because of the position of where that anatomical membrane is, skin, is directly below the hymenal remnants. And so when a penis, finger, what other object is attempting to find its way into the vagina, guess what it hits first? The posterior fourchette or the fossa, and then goes into the vagina. So if there's an energy force applied that's substantial, then there will be an injury noted there potentially, but not necessarily. Like I've already told you, the vast majority of times they don't have that injury there. But if we do see an injury, that's the first place we look, because that's the most common area where you're going to have an injury found.
So if there had been those findings, that would support a conclusion that there was a sexual assault?
No,
Those physical findings would support that?
No, not necessarily, because you need to know with consensual intercourse, you can also have a contusion or abrasion or any of the things that you listed.
But you're looking for it because it would make a sexual assault more likely if
Well, it
there
would
was.
indicate that there was an energy force applied
Okay.
to that part of the body that caused that injury.
Okay. And the same question, the cervix examination, it's the same thing. It looks for this, it lists in the report, laceration, hematoma. I'm not going to repeat the same issues that you were looking for in the vagina. Is that also, when you're looking for that, testing for that, you're looking for any evidence of a forced sexual activity?
Well, energy force applied to the cervix that
Energy
would
force.
cause.
Okay.
Yeah.
And if there were those types of injuries to the cervix, would that, from a nursing professional perspective, support a diagnosis that it was a sexual assault?
Not just in and of itself. There's a whole lot of components that have to come together in order for a nurse to come to a statement that.
Oh, no, I understand that. I'm just saying, though, I'm just trying to break this down into the examination and the purpose.
Okay.
I know that we've already said there's a lot of other things that are looked at. I'm just focusing on these exams because it was this part of the report.
Okay.
And just trying to get an idea of why you're looking for that stuff
Correct.
and what it indicates if you find it. Is that fair?
Yes.
Okay.
Yes, sir.
And in this particular case, there were none of these injuries in the vagina, cervix, or that part of the alleged victim's body, correct?
Correct.
All right. So really, the pelvic exam, would it be fair to say that it really tells you nothing in this case?
Well, from the visualization, but from the
This-
DNA.
This
yeah.
exam, right, not the DNA,
Okay.
this exam, what your office did is all
Yes.
I'm focusing on.
Yes, sir.
Okay. And the next part is the rectal exam, and you described how that's performed. It's the similar process.
Yes, sir.
And what is the significance if there were hematomas, lacerations, erythema, swelling, abrasions, contusions, or divots noted to the external anal sphincter?
That would tell me that there was an energy force applied to the anus or the perianal folds that was enough to cause the injuries that you described.
Okay. And in this case, those were not present.
That's correct.
So none of those injuries. Okay. Can you explain, what is the dentate line?
Dentate line is the demarcation line that separates the anus from the rectum.
Okay. And the anal column?
Anal columns are columns that we look for inside the rectum that kind of allow you to squeeze a poop out of your rectum.
Okay. And that was part of the exam in this case?
Always.
Okay. And again, I'll just ask, so what would be the significance if there were hematomas, lacerations, erythema, swelling, abrasions, contusions, or divots noted in those two areas?
Again, there would have been an energy force of significance to cause one of the injury patterns that he's listed above.
Okay. And in this case, none of that was found?
That's correct.
Okay. And you didn't do any DNA analysis or anything? That went to another person? So in terms of the exam in this case, when it comes to the vagina, the rectum, you found no signs of force being applied, as was the term you were using, correct?
No, I didn't say force wasn't applied. It didn't cause an injury to occur.
What were, I'm sorry, I was trying to get at the word you used, because I said sexual assault, and you said it would show that there was, what was the term?
An energy force.
Energy
applied.
force. And so this exam doesn't show you evidence of an energy force or not having an energy force, correct?
Correct.
Okay. Thank you.
Now, sorry, is part of the purpose of doing an exam to collect evidence?
Yeah, absolutely.
Yes. And you don't, fair to say that you don't know what evidence there is until you go look?
Correct.
In this case, there were swabs collected and a kit was completed.
Correct.
So there was an oral swab, a vaginal swab, and a rectal swab.
Yes.
Was there also blood and urine collected?
Yes.
Okay. So, and the underwear was collected?
Yes, there were fingernails,
Okay.
buckle.
So the whole kit was done, and in order to get the kit, you have to go into the vagina, into the cervix, into the rectum, and
Yes.
the mouth.
Yep.
And while you're there, would it be fair to say that it is, while you're there, if you see injuries and you are looking for injuries, is part of that so that the victim can know what injuries they have?
Yes, and then you have to show them how to treat that.
Now, Mr. Scroggins asked you about the significance of injuries or lack of injuries. You mentioned that it was incredibly uncommon to see injuries to the vaginal area even in cases where there was a sexual assault, because of the resilience of the vagina in that area.
That's correct.
I know I'm kind of putting you on the spot, but can you guesstimate, in cases where a patient reports sexual assault, what percentage have injuries and what don't?
For vaginal or cervical, I would say less than 25% have any injuries.
Password.
Just a quick follow-up on that last question.
Sure.
That's 25% of people who have reported sexual assault, right?
Yeah, that's the only people I see, sir.
Right, but what I'm getting at is people who say they were sexually assaulted, less than 25% show those injuries, correct?
That have an exam.
Right,
Just saying it, I can't tell.
right.
Okay.
So, but when you're saying that number, that's based on people reporting sexual assault, 25% or less most likely have actual physical injuries in those areas, correct?
Yes, correct.
Oh, thank you.
Can I clarify something?
Yes.
Thank you. I got a little confused, so I just want to clarify. Of the people that you see that get the full medical exam where you're going in the vagina, cervix, rectum, of those people, the number is less than 25%?
That have injuries, yes. So 75% of the patients I see do not have vaginal, cervical, os, anal, or rectal injuries.
Thank you.
Anything else, Mr. Chavez?
No, thank you.
All right,
Thank you.
any questions from the jury? Yes, Council Crouch, please.